What is Jentadueto? Linagliptin/metformin. Jentadueto, a combination of linagliptin and metformin, is an oral medication prescribed to help manage type 2 diabetes in adults. It is used alongside a healthy diet and regular exercise to improve blood sugar control. Depending on your provider's instructions, Jentadueto, linagliptin/metformin, may be taken once or twice daily. Both the immediate release and extended release formulations should be taken with food to minimize stomach upset. Common side effects of Jentadueto include diarrhea, cough, and nasal congestion such as a runny or stuffy nose. What is Jentadueto, linagliptin/metformin, used for? Jentadueto is approved for the treatment of type 2 diabetes in adults. It is not intended for individuals with type 1 diabetes or diabetic ketoacidosis. How does Jentadueto, linagliptin/metformin, work? Jentadueto combines two active ingredients that target blood sugar control in complementary ways. Linagliptin, a dipeptidyl peptidase 4, DPP-4, inhibitor, works by blocking the DPP-4 enzyme. This enzyme normally breaks down hormones called incretins, which help regulate insulin production and glucose metabolism. By inhibiting DPP-4, linagliptin increases incretin levels, prompting the body to release more insulin and reduce the amount of glucose produced by the liver. This helps lower blood sugar levels throughout the day. Metformin, a biguanide, lowers blood sugar through several mechanisms. It decreases the amount of glucose produced by the liver, enhances the body's sensitivity to insulin, and reduces the absorption of glucose in the intestines. Together, these effects help the body use insulin more effectively and maintain better control of blood sugar levels. What are the side effects of Jentadueto, linagliptin/metformin? Most side effects are mild and may lessen as your body adjusts to the medication. Contact your healthcare provider if symptoms persist or worsen. Common side effects: cough, runny or stuffy nose, or other upper respiratory symptoms, about 6%. Diarrhea, about 6%. Other possible side effects: nausea or vomiting, gas and stomach discomfort, weakness or fatigue, headache. Serious side effects: seek medical attention immediately if you experience any of the following. Lactic acidosis, a rare but serious buildup of lactic acid in the blood. Symptoms may include confusion, severe weakness, irregular heartbeat, rapid breathing, loss of appetite, nausea, or vomiting. Pancreatitis. Symptoms may include severe upper stomach pain, nausea, vomiting, or fever. Severe allergic or skin reactions. Signs may include rash, blisters, swelling, shortness of breath, or difficulty breathing. Always consult your healthcare provider before starting or stopping any medication. Jentadueto, linagliptin/metformin, should be used only under medical supervision as part of a complete diabetes management plan that includes diet, exercise, and routine blood sugar monitoring. Jentadueto, linagliptin/metformin, dosage forms. Jentadueto, linagliptin/metformin, is available in tablet form and comes in several dosage strengths to meet individual treatment needs. The average cost for 60 tablets of Jentadueto 2.5 mg per 1,000 mg, linagliptin/metformin, is approximately $344.03 with a free GoodRx coupon. This represents a 47.07% discount off the average retail price of $649.95. Typical dosing for Jentadueto, linagliptin/metformin. The appropriate dosage of Jentadueto depends on your current treatment plan, blood sugar levels, and medical history. Always follow your healthcare provider's instructions for safe and effective use. Jentadueto, linagliptin/metformin. Typical starting dose: 2.5 mg per 500 mg by mouth twice daily with food. Maximum dose: 2.5 mg per 1,000 mg twice daily. Jentadueto XR, linagliptin/metformin extended release. Typical starting dose: 5 mg per 1,000 mg by mouth once daily with food. Maximum dose: 5 mg per 2,000 mg once daily. Taking Jentadueto with meals helps reduce the risk of stomach upset, a common side effect associated with metformin. Jentadueto, Linagliptin/metformin, contraindications. Certain health conditions make Jentadueto unsafe to use. It is essential to inform your healthcare provider about your medical history before starting treatment. Do not take Jentadueto, Linagliptin/metformin, if you have severe kidney problems or significantly reduced kidney function. Acidosis, sudden or long-term buildup of acid in the body, including diabetic ketoacidosis. A history of allergic reaction to either linagliptin, Tradjenta, or metformin. Your healthcare provider will evaluate your kidney function and overall health before prescribing Jentadueto to ensure it is safe and appropriate for you. Pharmacist tips for Jentadueto, Linagliptin/metformin. Take Jentadueto, Linagliptin/metformin, with food to help reduce stomach-related side effects. The metformin component can cause nausea, diarrhea, vomiting, or abdominal discomfort, and eating with your dose can help minimize these issues. While taking Jentadueto, it's important to stay well hydrated. Drink enough fluids each day, especially if you experience vomiting, diarrhea, or illness. Dehydration can increase your risk of lactic acidosis, a rare but serious condition where too much acid builds up in the blood. If you are scheduled for surgery, notify your healthcare provider in advance. They will guide you on when to stop and restart Jentadueto, Linagliptin/metformin. During surgery or fasting periods when you can't eat or drink normally, your risk of lactic acidosis may increase. Before undergoing imaging procedures that use contrast dye, such as CT scans, inform your doctor or radiologist that you are taking Jentadueto. These dyes can temporarily affect kidney function, which may lead to a buildup of metformin in the body and increase the risk of lactic acidosis. Always wait for your provider's approval before restarting Jentadueto after these procedures. Seek immediate medical attention if you experience symptoms such as feeling cold in your hands or feet, weakness, dizziness, confusion, nausea, difficulty breathing, stomach pain, or a rapid heartbeat. These can be warning signs of lactic acidosis, which requires urgent treatment. Jentadueto, Linagliptin/metformin, can interact with other medications. For example, ranolazine, Ranexa, used for chest pain, can increase metformin levels in the blood and raise your risk of lactic acidosis. Always tell your provider or pharmacist about all medications, supplements, or over-the-counter products you're taking before starting Jentadueto. Routine blood tests are essential while using Jentadueto. These tests help your healthcare provider monitor for side effects such as liver injury, changes in vitamin B12 levels, or signs of lactic acidosis. Regular testing ensures your treatment remains safe and effective. Finally, remember that medication works best when combined with a healthy lifestyle. Eating a balanced diet and exercising regularly are key parts of managing type 2 diabetes. Work closely with your healthcare provider to develop a plan that fits your goals and health needs. If you found this information helpful, make sure to subscribe to HeInfo, your trusted source for science-backed health information. Stay informed about the latest medical insights, treatment options, and pharmacist-approved health tips.